Just when we thought we had moved past the era of masks and sanitizers, there's now a growing call from health professionals to reintroduce some of those same protective measures, at least temporarily. The South African Medical Association has joined international experts in raising concern over rising flu infections and the presence of emerging COVID-19 Omicron subvariants, such as the NB 1.8.1, which is now circulating in multiple countries. Joining us is Dr. Mvuyisi Mzukwa, chairperson of the South African Medical Association. Dr. Mzukwa, always good to speak to you. Now, what prompted this renewed call for mask wearing during the 2025 winter season?
Good afternoon to you, Hugo, and your listeners, your viewers. I must say that we have not yet made a call for wearing of mask and everything else. But what we are doing is that we are cautioning, South Africans that there is a new variant, but we shouldn't be worried about it. It's circulating in other countries, but it's not causing severe infections. But as you may imagine, the problem is not with the transmission only. It's about those that are having vulnerable people with underlying medical conditions. I think that's when we're saying, if you have symptoms, whether flu symptoms and stuff like that, it's always good to protect those that are around you, putting on a mask, but making sure that you don't attend large gatherings if you have got flu symptoms. But it's not like we are bringing some panic of some sort. There's nothing to panic about.
So let's talk about COVID numbers. Is there still some prevalence of COVID at all worth mentioning?
There is. Yes, there is COVID. There is still COVID. It's just that we call it it is in its endemic form. In other words, it's in existence, but in very low numbers. But you do have, as you have seen before, there's this evolution of COVID over time, giving birth to changes, variants, the same virus changing itself, to adapt the environment. It had started all the way from, at the moment it's dominant in China and Hong Kong, but it's available in other countries like Australia, UK, US. So it's being monitored. Even the World Health Organization have declared it a variant under monitoring. In other words, we're looking at the characteristics of that variant. We're looking at its spread. We're looking at the severity of the symptoms. But it's early days. There's nothing to worry about at the moment.
So when would alarm bells start ringing?
Well, if there is increase in hospitalization of, obviously, if you've got pressure on the public health facilities or even private sector, if you have, and stuff like that, I think people would be worried about that. But as far as we know, the information that we have now is that the symptoms are not severe. It's normal symptoms that you get: a sore throat, you get headaches, you get fatigue, because of also you get muscle pains, but you may have also some gastrointestinal symptoms like diarrhea and vomiting. But like I said, it will be only worried if you belong to those people that are with underlying medical conditions. Even those people, they are monitored by their healthcare workers, especially if they pitch up in their rooms, to be taken good care of.
Dr. Mzukwa, there's clearly a sense of pandemic fatigue. Now, how do we strike the balance between precaution and overreaction? Because there's obviously information that you need to put out. People need to be cautious. You've talked about those with comorbidities or underlying conditions.
Yes, I know that, there's that, stage where people, they seem not to care much about, that information. But it is critical for, the Medical Association and other, organizations, if there's anything, to continue educating the public, not to make them panic, but to say there is this that we're facing, because we know in South Africa we are in a flu season, but it does not mean that we have a rise in COVID. It means that we've got a rise in the normal flu viruses that we normally encounter. But it is important that we encourage communities, one, to get vaccinated, especially for normal flu vaccines, so that if you are in a vulnerable group, you can be protected in the severe forms of flu, other than COVID. So very important that we keep, this health literacy going on, so that people don't find themselves, stuck in or even overburdening the health establishments in the country. I think it's very important for us.
Okay, so no worry about COVID-19 and the various Omicron subvariants. But are we seeing signs of increased respiratory infections locally from both flu or COVID-related at the moment? And what precautions should people be taking?
Yes, it's a flu season. We do get numbers coming to whether clinics or doctors or even hospitals. But what you need to do is, as we have indicated, you do need to get a jab, for flu. It assists you, especially with the severity of symptoms. Sometimes you may get flu, but the symptoms are not as severe as when you didn't get the jab. The other thing is, it assists, you may need to protect people that are in your surrounding. For example, it's not a good thing that you see your child has got flu symptoms, but you still take the child to school. I think you need to take the child away from school so that you protect other children. But because in those schools, you might find that there are children with underlying medical conditions. So you don't want to expose those children. So very important that how we manage, ourselves around this. I mean, putting up a mask was not only meant for COVID, it was also meant for flu. If you've got flu symptoms, you protect other people in the workplace, because you understand that people are not the same. In other places, you might encounter people with underlying medical conditions. So you don't want to bring a bag that is going to complicate other people's lives.
Yeah, so precautions absolutely critical. Dr. Mvuyisi Mzukwa, chairperson of the South African Medical Association, appreciate your time.